Good morning again, folks. This is Dr. Mike, and it's October 23rd. So this is our 23rd installment of 30 for 30, tips and actions to help you build your medical exercise training practice. And folks, we're back here again with the hieroglyphics of the medical exercise training client management system. Now, we've already gone over, giving you an overview of the concept. We've also gone over yesterday the initial contact and the initial session. So what I'd like to do today is talk about the assessment. Now, I initially said we were going to go over the assessment and the post-assessment today, but as I was driving in this morning, I kind of thought back and said, no, let's just simply talk about the assessment, because the assessment is a vitally important aspect of what you offer as a professional, as a medical exercise specialist. So a couple things before we start. With the assessment, folks, please never, ever, ever give away your assessment for free. Never. Whether you're doing personal training with a client or medical exercise training. Folks, the assessment is the essence of what you are as a professional. And when I see professionals out there giving away the assessment, I've seen attorneys do it, massage therapists, chiropractors, personal trainers. When you give away the assessment, folks, you're giving away what makes you a professional. Please don't. Now, if you've gone through our medical exercise specialist program, you got the certification, you learned in one of our lessons about the musculoskeletal screening. Now, I highly advocate, if you're going to do some type of free screening or assessment, give away the musculoskeletal screening. It allows you to determine if the client is appropriate for exercise, but along with that, it allows you to identify potential problem areas with exercise, which you can certainly share with the client, and that doesn't give away all of your professional knowledge. So I implore you, never give away the assessment process for free. That's what makes you a professional, your assessment process. Whether you're a lawyer or a doctor or a mechanic or whatever the case is, when you start giving away the assessment for free, you've given away your professionalism essentially. Because everything that you'll do is based on that assessment process. So let's talk about the assessment here. Now, one thing I have not included with this assessment diagram here is the musculoskeletal screening, and I'll work that into this. So remember, you've already communicated with this client on the phone. They're now in that initial session. So this is the admin portion of that initial session. So now you're going to now start the assessment. So all the paperwork is done, payment arrangements have been made, any information with regard to insurance, you got everything. Now you're going to start the assessment. So with this assessment, the first thing you want to do before you put your hands on this client and do anything is to conduct a medical history interview. Notice what I said, interview. Not just simply you fill out the medical history form, but an interview. Folks, I cannot tell you how many times with younger therapists that we brought into my offices, how many times they would come back and report to me the patient reported a secondary condition that they didn't pick up on in the medical history, but in the medical history, they just simply had the patient fill out some forms, ask a couple of basic questions, and that was it. Well, the secondary aspects of the comorbidities were never picked up upon, but they impacted on the treatment process when they were providing physical therapy services. Now, you're not talking about treatment when we talk about medical exercise training, but it's the same concept. The medical history should be an interview, an interactive interview. And if you do have a medical history form, you ask each question on the form of the client and get a verbal response. What you're looking for are affirmatives or negatives, yes or no. But when the client says, that now says we need to explore that more. But when clients are giving you affirmatives, yes or no, okay, and I should say strong affirmatives. I'm affirming yes, I'm affirming no. Those are questions that you probably can move beyond. But when they're questionable, it's not 100% affirmative, now we need to start asking more questions. And those are the areas that you need to explore and go a little bit deeper and ask more questions so that you have a clarification. You're clear on exactly what's going on with that client. So the medical history is important. Your medical history should basically tell you when this started for the client, what the intensity is of it, what has been done to this point, what is the plan for moving on to do anything about it with regard to consulting their medical professional, and most importantly, gives you an idea of what they can tolerate now. The key concept with the whole medical history is their current tissue tolerance level. What can they tolerate right now with regard to exercise? And with that history, will give you an idea of where they come from, where they are now, and also gives you an idea of what they can tolerate as far as exercise goes. So we got to get that medical history. One thing don't do in the medical history is chase down pain. Pain, folks, is subjective for everyone. Clients love to tell you about their pain. Oh, it hurts when when it rains. It hurts when it's cold. They'll go on and on with that. Please, if you would, and we say this in our medical exercise specialist training series, stick with the facts, only the facts. Just get the facts. The clients want to give you a lot of subjective information. Steer them away from telling you about their pain and focus in on what happened, when did they have the injury, and one thing that's important in that medical history is if they can show you how they injured themselves, that gives you a far greater understanding of the mechanism of injury and also gives you a far better understanding of what's going on with them if they're having problems now. Yesterday we had a couple of folks, MESs, that came over to visit our facility, and one of them said he wanted to focus on managing clients' pain. Don't get caught in that trap, because pain takes you down a rabbit hole, folks, that is 100% subjective. And if you're going to go down that rabbit hole, make sure you understand referred pain, radicular pain, and radiating pain. Okay? You got to understand those three: referred, radicular, and radiating. They will twist what you see as far as what you think you see with pain, and it could be something completely different. So don't get caught up in that process. Also, with the assessment, we want to get baselines. We're looking to get baselines in areas such as range of motion, strength, flexibility, endurance, function. We're trying to get baselines, and the baselines will be what we'll work from as far as improving the client. Now, once you've done that medical history, you can also screen the client, do the musculoskeletal screening to determine if the client is appropriate. Folks, I can't tell you how concerned we are that clients are going to be referred to you because the insurance has stopped paying for PT, or the doctor, therapist, or chiropractor said they've reached their maximum capabilities and they're referred to you as a medical exercise specialist, but they're not appropriate for you either. They're not what we call medically stable. So perform the medical history. Also go through the musculoskeletal screening to see if they're appropriate for exercise. But once you finish the screening and you go through with your normal regional assessment, and that regional assessment should be based on the shoulder or the knee or the spine. And we have regional assessment forms that we allow you to purchase through postrehab.com. Establish baselines, range of motion, strength, function, those types of things. Once you've done that, now you can start identifying the functional deficits that the client has. In this assessment process, the key thing, the reason the doctor, therapist, or chiropractor is sent them to you is because the client has functional deficits. We need to identify those functional deficits. What are their critical job demands or critical lifestyle demands, and where do they have deficits with function that with exercise we can help remedy? With that, as you're assessing the client, we're always looking for red flags. Red flags that indicate the client is inappropriate for exercise, or exercise may exacerbate their problem, and maybe we need to modify the exercise a little bit. Decrease the intensity, limit the range of motion, something along those lines. One of the key things, though, is with all of your clients, check blood pressure and heart rate. I'm going to make that perfectly clear. From this point on, check blood pressure and heart rate with all of your clients in those first two sessions. Okay, assessment session, the session following that. Now, if you have clients that are diabetic, as I mentioned before, you need to check blood glucose. You don't do it, the client does it. The client actually uses the glucometer to measure their blood glucose level. You should be right there standing there to see what that measurement is. And then after you've finished your assessment process, you now, based on the assessment, select the appropriate protocol to follow with that client as far as progressing them through the medical exercise training course of management. Again, this is to give you an idea of, is the client appropriate? What are their baselines? What are their functional deficits? Do they have any red flags that will eliminate them from being an appropriate client for exercise? And with that, then you select the appropriate protocol. I cannot begin to stress the importance of checking blood pressure and heart rate in your clients. You can even use an electronic method for doing this, but if they're diabetic, please make sure they check their blood glucose before they start. Okay? So that kind of goes to the assessment. Tomorrow we'll take all of this and talk about the post-assessment segment, but please, if you would, go over to MedX Pro 360. We go over this and even more to help medical exercise professionals build their practice, produce outcomes for their clients, and most importantly, start communicating and connecting with medical professionals to show them you are the next logical step after physical therapy, chiropractic, and medical care is over. So thanks for watching. We'll be back tomorrow, and tomorrow we'll talk about the post-assessment aspect of the MET client management system. If you have questions for me, email me at drmike@postrehab.com. Thanks again, folks. Bye.